we've been tracking the impact of COVID on our program participants through a variety of tools from as early as April, including undertaking some really rigorous qualitative data collection in 4 countries. This helped us inform what we were doing in terms of our programming, but was also really helpful in designing the follow-up piece with our colleagues in Alliance 2015. 2 things really jumped out at us. One was the disproportionate impact on those living in urban areas, and the second was the sheer shock to the education system that was there. In the urban areas, COVID had compounded a whole host of other issues that people faced. Challenges did not just exist in terms of ability to access protective material like soap or face masks, but also in terms of the impact on their livelihoods. Many people depending on casual labour and small-scale trading, both of which had been really badly hit by the restrictions put in place to prevent the spread of COVID. So to address this, in Haiti, in the urban areas of Cité Soleil, where we've been working for quite a while, we were able to reprogram our funding to provide 4,000 households immediately with wash kits and to support the Ministry of Health and Population with mass awareness campaigns. But perhaps more importantly, we were able to provide a cash safety net transfer equivalent to about $75 in May to help people deal with losses in their income. In Nairobi, we focus very much on food security and responding again through cash assistance. Part of the challenge here, though, was to make sure that the cash was sufficient to allow people access a minimum expenditure basket. And we work very closely with people on the government social protection program, just to consider the appropriateness and adequacy of what was being provided. As I mentioned, the other big challenge was the loss of education for so many children. As we see in the report, over 90% of those we work with identified that schools were closed at some stage throughout the pandemic. Access to the most vulnerable in terms of television, radio, and internet has been challenging, which is something we saw in the research. In addition to working with radio programming and helping to develop the curriculum for that, we facilitated things like community learning groups, caregiver engagement, and the delivery of child-friendly COVID messaging throughout. In Sierra Leone, for example, we paid particular attention to making sure the small community learning groups were COVID restriction compliant, and that these groups were led by teachers who were provided with training, support, and resources to engage with the radio programs that were being broadcast and complementary learning activities. Now, fortunately, as schools reopen, we've been able to readjust our support, providing safety measures and materials in schools, but also undertaking back-to-school campaigns in a number of countries that specifically target those at risk of not returning, the likes of girls, displaced children, and people from minority communities. We've done a lot of work on teacher training and curriculum catch-up because there's a year of missed education to be caught up on. And of course, all of this is done in very close engagement with the relevant ministries and supporting government response and sector plans.